Or someone say it's in the next page.
It's not even in the book.
I didn't see that in the new vision section.
But the one they have for near vision is a P.
They just say near vision acuity chart. They don't say.
Help on that one when you go back. It's what chart do you use for color blindness?
Ichihara.
Yep.
Ichihara?
ISHIHARA. ISHIHARA.
Ichihara.
What's a cloudy lens called?
Cloudy lens?
Isn't that glaucoma?
Cataract.
Cataract?
Cataracts, glaucoma.
It's called cataracts. It's cloudy or oblique
Cataract
area in the
glaucoma is
normal
the
clear lens. That's on
watery
page
one.
746.
And cataracts is the cloudy one.
Increase intraocular pressure is called what?
Ocular pressure?
Already covered that once.
Yeah.
What do you smoke weed for?
Glaucoma.
Got pressure in your eye. What's a drooping eyelid called?
A droopy eye? Droopy eye. Astigmatism? Oh, it's called a M. Is that it? A-M.
Starts with a P.
A P? Get out of here. But this is what it says. It says lazy eye.
Is it presbyopia? Less flexible. Changing the focus to near.
A P.
It's not presbyopia.
Yes. PTOSIS.
Ptosis. P-T-O-S-I-S. Ptosis? Ptosis. Where is ptosis?
When installing eardrops in a child, how do you pull the pin out? The ear.
Down and right.
That up and back is for an adult.
Down and back. For
Alright.
down.
The next 10 are true or false.
Let me get right on that.
If a patient calls the physician's office with immediate life-threatening emergency, place them on hold while you activate EMS.
False.
I'm going to hang up and call 911.
I need the question.
Documentation of the patient's chart of an emergency phone call that has not resulted in a physician's office visit is not necessary.
False.
False. Do you document the patient's chart of an emergency phone call that has not resulted in a physician's office visit? If they call you, tell you you have chest pain, they have chest pain. You tell them how you going to call 911. Do you document that in their chart? Yes, you do.
That's number 3.
On such and such date, such time, patient ABC contacted us in reference to chest pain. We told them to hang up and dial 911. Because that way, when you get sued later because they didn't do it and you told them to, you're covered.
What's number 2?
So was it false or was it true?
The physician must write a prescription for home oxygen use. True. Oxygen is a drug. A blind or oral finger sweep should be used to remove foreign airway obstruction in all age groups of choking victims.
False.
False.
What was that, the fingers?
What, the bone, what?
Line finger sweep to remove foreign airway objects in all age groups.
Finger. Sweep.
To dislodge a foreign object from the airway of an infant. Chest thrusts that are applied in the same position as those used in infant CPR. True. You do back blows and chest thrusts. You don't do like the Heimlich maneuver you do on an adult. For a kid, it's basically it's CPR, same thing. You're going to do chest compressions and back blows. Typically, we start with back blows if we can. A patient with diabetes may go into shock with overdose of insulin.
True.
True. If a patient reports an animal bite without a break in the skin, the patient can be instructed to wash the area well and observe it for signs of infection. True. Don't need to come in for that. Though I've been called, people call 911 for a lot less than these. Can't tell me how many times I've ran emergency down in Louisiana for mosquito bites.
They're crazy. Done?
A patient undergoing anticoagulatory therapy should be seen immediately for any bleeding wound.
True.
True. Don't bleed out. And what's anticoagulatory therapy?
Should be seen immediately.
Blood thinners. Is aspirin a blood thinner?
Yes.
No, it's not.
Mm-mm.
It does not thin your blood. It lubricates your blood. It does not thin it. Alright, your next one. If a patient is bleeding profusely from an arm laceration, apply direct pressure to the radial artery.
True.
The break.
It says, if a patient is bleeding profusely from the arm and a laceration, apply direct pressure to the radial artery. Radial's in your wrist. It's not going to do anything.
You have to do it to the brachial, right?
It might help bleed a little better. Mild frostbite may be treated by gently rubbing the affected extremity. Ooh, never rub frostbite.
Huh?
Never rub frostbite.
False.
Rubbing.
So it's false?
Yeah.
False.
Yes.